in time before we get started, but thanks for joining us. Give it another moment or two. We'll just give it a few more seconds and then we'll get started, just to stay on time and respect everybody's time. But thanks to those who are joining us. People joining, so we're going to give it a few more seconds. Well, I think we'll go ahead and get started. It's just 1 minute past 7. So good evening, good afternoon. For those that are joining us, welcome. I am Krista Rubin, nurse practitioner, and I am the AMED Skin Cancer's Ask a Skin Cancer Nurse. Thanks for joining us for today's webinar titled The Rising Toll, Understanding the Surge in Skin Cancer Mortality. And like I said, I'm Krista Rubin, your host, and AMED Skin Cancer's Ask a Skin Cancer Nurse. For those of you that are joining us for the first time, welcome. And if you're not familiar with our organization, Aim at Skin Cancer, it's a foundation dedicated to providing education and raising awareness about skin cancer and to address the needs and wants of those affected by skin cancer. So our webinar series is designed to explore a comprehensive array of topics surrounding skin cancer treatment, management, and the emotional health of those affected by skin cancer. So joining me tonight or this afternoon is Dr. Wesley Yu. Dr. Yu is a dermatologist at Oregon Health and Science University. He is double board certified in dermatology and Mohs micrographic surgery. Dr. Yu is an associate professor of dermatology at OSHU School of Medicine, and he specializes in the treatment of skin cancer and management with Mohs surgery as well as reconstruction, and he's considered an expert in this area. So I'm thrilled to have you join us this afternoon or this evening, Dr. Yu.
Thanks so much, Krista. I really appreciate it.
Great to have
Thanks
you.
for inviting me.
Yeah, great to have you. Okay, so I think it's important to start with some of the basic facts. And one of the facts that may be a surprise to many people is that skin cancer is actually the most common cancer in humans. And I think that's underappreciated. So maybe you could start us off with just talking a little bit about the statistics. What are the numbers? How many people are affected by basal cell carcinoma and squamous cell carcinoma in particular?
Yeah, I mean, I think the point you make is a really good one. Often when we think about cancer, and when cancer incidence is listed in the news and in publications, skin cancer gets left out. That's for a couple of reasons. The first is that it's actually so common that it's hard to keep accurate statistics on it. And the second is that because there are so many, the official sort of registries where we count cancer incidence don't sometimes leave out important cancers like basal cell carcinoma and squamous cell carcinoma. We do know that melanoma is one of the top 5 cancers in the United States. But again, that's only one of the skin cancers. And so when we think about skin cancers as a group, the non-melanoma skin cancers or keratinocyte carcinomas like basal cell and squamous cell plus melanoma, it's actually more cancers than any other, or there are more of them than any other cancer combined. So yeah, definitely a public health concern, and something that is quite common. So if you have a skin cancer, you're not going to be the only one. You probably know somebody or have a first acquaintance that has had one as well.
Mm. Yeah, and so what you said that some of the registries kind of don't capture that data, it's probably the numbers that we have are really underestimated. It's possible that they are underestimated. And so I think the latest statistic I saw was something like 1 in 3 Americans will be diagnosed with skin cancer in their lifetime. So
Yeah.
that's, pretty staggering.
It is. And, I think that's probably even an underestimate. I
Right.
mean, 1 in 3 is high, but I think, it may even be higher than that, particularly in certain communities. And so, again, if you have one, it's great to have a community like AIM, where you can get tips and knowledge from others who have had that.
I'm going to have you I'm going to touch back about what you just said a moment ago about certain populations are at greater risk, but I'm just wondering if you could talk a little bit about the trends. What kind of trends are we seeing in terms of skin cancer incidence?
Yeah. So skin cancer incidence is rising, and there's actually a debate about why that is. But I think some of the things that we all agree on are that the risk factors for skin cancer are really important to think about, and that those risk factors have, sort of increased in impact on the population as a whole. So one of the biggest risk factors is, of course, UV exposure. So exposure to the sun. Solar radiation is the most common source of UV exposure. And as we've thought about getting more exercise, being more fit, people are more likely to participate in outdoor activities. That's a good thing, but it also comes with some risks. And so people who are out in the sun a lot without protection oftentimes are risking skin cancer down the line. I think it's also important to acknowledge that the science on this has progressed quite a bit. So, if you were born in the 50s, 60s, 70s, we didn't know as much about the risks of skin cancer and the sun. And so, as a kid, you may have had, sunburns and sun exposure that we at the time, thought was good for you. A lot of my patients say, I had all of these sunburns. Does that mean that I'm destined to have a ton of skin cancers? Well, that may be true. You may get some skin cancers, but our goal is also to be able to prevent them. And so, we talk about ways that we can reduce the number of skin cancers and then take care of the ones that come up.
Yeah. So lots of good information that you just gave. I'm going to come back to some of those points because I think I want to
Yeah.
delve into that a little bit more. But let's talk about some of those habits. Let's talk about the habits. I mean, I did grow up in the 70s, as much as I hate to admit it. I was very, very, very young during that decade, but certainly remember the days of my colleagues, my peers, students going outside with iodine, baby oil, getting ready for the prom, or just spending the summer outside. That was kind of the thing to do back then. So certainly we've learned that our habits weren't so healthy. But what are some of the habits that people have that may increase their risk for skin cancer later in life?
Yeah. So definitely, getting sun exposure without protection is one of them. Another thing that was popular, and still is popular, is our tanning beds. Tanning beds are one of the biggest risk factors for skin cancers, and particularly for deadly skin cancers like melanoma. So
Mhm.
you really want to be careful with those kinds of exposures. And what I said about our knowledge about UV exposure and the 50s, 60s, and 70s. It's not limited to people who were born in those decades. Now we have uh, things like misinformation online about the safety of sun protection and the balance of vitamin D versus sun exposure. And some of that misinformation I do see in clinical practice. There are younger patients who are coming in with skin cancers as well, and so it is important to try to prevent those. Some of the healthy habits you can have, if you want to keep going out and enjoying the sun, which I think is a really good thing. It's just to remember to be protected, hat, UPF clothing, and try to be in the shade when you can, and wear that sunscreen.
Yeah. And so you talked a little bit about age. I want to just get back to that and talk about
Mhm.
age as a risk factor. Can you just expand upon that a little bit?
Yeah. So the most common time to get skin cancers is going to be usually after in your 50s or 60s, and later. And the reason for that is just because of how cancer operates. So you think about this kind of uh, like cavities, kind of. Um, you know, you're the more you expose your teeth to sugar or other things that can break down into sugar, the more cavities you're going to have. But that also takes time. So in the same way, cancer is a mix of exposure, time, and genetics. And so those three factors, so exposure we've talked about already, right? UV exposure. Time, so you need time for those cells to sort of mutate and grow into a cancer. And then genetics, so just having background genetics where you're more likely to have damage from UV. And so those three together, so we've talked about UV, age usually is going to be 50 and over. And then genetics, really it's whether you burn easily, because a burn is a mark of that UV damage on your skin. And so, the more sun the exposure to sun impacts people differently, and causes more mutations in people who don't have as much protection. And that protection comes from pigment. So people who have lighter colored skin, particularly if you have really light skin with red hair or blonde hair, you're not producing as much melanin to protect your skin. And so any UV is going to be more damaging.
So lots of information there. I like your analogy to cavities because I think that's something relatable and understandable. And we do things like have our children go to the dentist, get fluoride treatments. All of this is to protect. So we can kind of think of sunscreen, shade, clothing as methods of protection to prevent that cavity, to prevent that sun damage. I like that a lot. I might have to use that. I'll give you the credit, but I might have to use that because I think people can understand that sometimes more so than skin protection.
Yeah.
So I'm sorry, were you going to say something?
Oh, no, I was just going to say the other place that analogy comes in that I use it a lot with patients is in terms of early detection. And so one of the reasons that skin cancer is um, so common, but also something that we can treat really well, is because we're good at detecting it early. And so just like cavities, if you get those regular exams where you catch them early, we can take care of it, and it can be a relatively simple process.
And
Um,
curable in most cases.
right. And curable in most cases. So, the most recent statistics on melanoma is essentially 95% survival at
Mhm.
5 years. If you, particularly if you catch it early, and if you catch it really early, that's 100%. The problem is if it goes on and progresses and isn't caught early, then those survival statistics go way down. And so, similar to a cavity, if you let that go, you end up with a root canal, or even worse. And so, we really want to catch those early.
Great. So I have a few more questions, but I also want to just tell the audience that if you have questions, please submit them through the Q&A function. We're happy to answer any questions that you might have about skin cancer or anything related. Please, we encourage you to send in your questions as well. So, Dr. Yu, I'd like to go back to talking about prevention and early detection because they're two different things. Preventing a skin cancer versus identifying it or treating it early are really two things. In the medical world, we call that primary prevention and secondary prevention. So many of my patients will say to me, well, I already have advanced skin cancer. What's the point of wearing sunscreen? So can we talk a little bit about that and talk about how important it is to really continue to protect your skin and how even though you may have already been diagnosed with a skin cancer, the importance of trying to prevent or at least detect early another skin cancer. This is a concept that's very difficult for many people, and I'm not sure I always explain it well. So I'd love to hear your thoughts.
Yeah, it's a hard concept to think about, but I'll try to explain it. So um, primary prevention is always important, and I kind of think about skin cancer, actually, especially if you've gotten multiple of them, as almost a chronic disease. It's not something where there's just a single spot that you can take care of anymore. It's that your skin has gotten a lot of damage, and so you're prone to getting more and more skin cancers. And so what you want to do is try to prevent as many of those as possible. You're not going to prevent all of them, but you want to prevent as many as you can. And so for my patients with a lot of skin cancers, our goals are usually not to necessarily stop getting skin cancers, but to get one every 3 years instead of having three every 1 year, right? And so if we can slow those down, then number one, it's a lot nicer because you don't have to come in for surgery and you can avoid some of those procedures. But number two, you're at much lower risk for having a very serious one, right? If you imagine that you're just getting skin cancer after skin cancer, three, four, five a year, one of those is eventually going to be a serious one. Whereas if you get one every 3, 4, 5 years, it's much more manageable. And so we set those kinds of goals. One of the things that can help with that, right, is sun protection. And sun protection, sometimes people say, well, the damage I got as a kid, I can't reverse. And that's true. But what you can do is prevent that last straw on the camel's back, right? And so there's good evidence that if you do sun protection now, you can actually spread those skin cancers out. So you're only getting one every 3, 4, 5 years.
Mm.
Um, Part of that, so and I'll just go quickly through sun protection basics. A lot of people think about sunscreen first, but that's actually a little bit lower on the list. So the
Mm.
first thing is just modifying when you go out and when you go out, whether you're in the sun or the shade. And so if you can be in the shade, that's great. If you can modify your activity so you're not in the blazing heat of 10 to 2, then that's better as well. The second form of defense is physical protection. So that's going to be hat and clothing. And then the third is sunscreen. And sunscreen, I think it's important to mention, needs to be reapplied. And it's important to put on enough in the first place. And so there was actually a Japanese study that was done to show that if you put it on once and then put it on again 15 minutes later, that is getting much closer to the amount you're actually supposed to put on the first time instead of just putting it on once. So if you're going to put on sunscreen, put it on once, then reapply it 15 minutes later, and you'll have the right amount on.
That's really interesting. And I get that a lot. I get that a lot actually, even from nursing colleagues or just friends. They'll say, oh, I put sunscreen on first thing in the morning, or it's in my makeup. And so I'm good for the rest of the day. But the reality is we don't really put on makeup as we go on through the day. So without that reapplication of some sort of sun protection, we're really not getting the benefit of it. So that I know is one of the misconceptions that's always heard. But the key to sunscreen, I always tell my patients, is reapplication every hour and a half to 2 hours.
Absolutely.
And
Yeah.
emphasizing there's no such thing as sweat proof or waterproof. So if you do go swimming or you're sweating and just dripping from a marathon or something like that, you have to reapply. That's key information.
Yeah.
Talk a little bit about geographic location. So folks
Mhm.
that, live in Hawaii versus those that live, like myself in New England. How do our behaviors frame our risk for skin cancer based on geography?
Yeah, it's really interesting because that's a interaction of environment plus behavior.
Right.
And so, of course, one of the reasons we know that skin cancer happens in people who are getting sun exposure is because the incidence is higher in places where there's more sun, and where UV exposure is higher. And so, if you're in the Sun Belt, if you're in Hawaii, if you're in a tropical region, you're going to be getting much more intense UV exposure. And so your risk of getting skin cancer is higher. However, now that we know about UV as a risk factor for skin cancer, People will often protect from the sun, whereas in places like where I live in Oregon, sometimes people think, oh, it's a cloudy day outside, I can go out without any kind of protection.
Mhm.
And so sometimes we see a reversal of those trends. In the state of Oregon, for example, we have one of the highest rates of melanoma in the country. And part of that is because people's behavior isn't adjusted to protecting for that UV. And so people in maybe more cloudy areas are exposed, number one, to more UVA because that comes through the clouds. And number two, when they do get sun, are often more likely to burn and so get more periodic, intense sun exposure that is more damaging. So I would say if you're in a tropical region, keep protecting from the sun. You know how to do that now. And if you're in a more cloudy area, just remember that UVA is coming through, and that can be immunosuppressive as well as carcinogenic. And number two, when the sun does come out, just be more careful because you haven't had the chance to have UV hardening, which is essentially producing pigment to protect yourself, and so your skin is going to be more vulnerable.
So I'm going to have you just clarify for our audience a couple things. One, talk a little bit more, explain UVA versus other UV rays. And then also when you talk about immunosuppressive and carcinogenic, can you just explain those for our audience?
Yeah. So usually we think about so UVA is lower energy UV, and typically we don't think of it as having as strong of of mutagenic potential, right? So cancer is essentially caused by mutations in DNA, um, and UVA is part of the UV spectrum that is lower energy and doesn't have as much potential to cause mutations in skin cells. And so we don't typically, in previous decades, we might not have thought of it as being as carcinogenic.
Meaning
The
cancer
problem with it,
causing.
cancer causing, right? Sorry. um, but UVA also, even though it is not as mutagenic or is not going to cause those mutations, it can suppress your immune system locally. And so if you get exposed to UVA, your immune system is not as likely to detect and prevent those skin cancers from popping up. And so just like people who have medical immunosuppression, so transplant patients or people with genetic diseases where they're not as likely to mount an immune response, people who have a lot of UVA can develop more skin cancers. And you might be wondering, well, how does immunosuppression relate with cancer? The immune system is really important for monitoring your body and will detect and attack anything that's foreign. And cancer is one of those things that can be caught by the immune system and destroyed before it gets going. And so, if your immune system is active and healthy, it will actually destroy some of these precancers or even cancers that are kind of starting, just a few cells, and that you won't even know about. But if you take away your immune system or suppress your immune system, then those cancers can get going and then become clinically observable and become a problem.
Mhm. Yeah, I think that is important in the sense of understanding what your individual risk is. So if you're somebody that frequently has sunburns, then the areas that you're getting sunburns, that immune reaction is suppressed. So if you have those repeatedly, you have less and less, your body has less and less chance of being able to kind of repair some of that damaged cell or cells. Yeah, so that increases your risk. So let's talk a little bit about what are some practical points. You've talked a lot about prevention, which has been very helpful. What are some other tricks that you give your patients, or what are some other resources that you could describe to enable people to protect themselves more or reduce their risks?
Yeah. So you asked me to differentiate between prevention and early detection. I'm sorry, I didn't get to early
That's
detection. So,
fair
so we've
enough.
talked
Yeah.
a lot about prevention. The early detection part is also a important practical tip for protecting yourself from skin cancer. So, if you are concerned about having skin cancer, it's important to see a dermatologist, get a full skin exam. And I think the thing that people I think is most helpful for people is to get that full skin exam, but then after the exam, look at your own skin and
Mm.
think about what spots you're seeing, because those spots were okay by your dermatologist's eye, right? And so if you get that full skin exam, then afterwards look at your skin. It gives you a good baseline for which to compare later on. And so then from that point on, you can sort of say, okay, if there's anything new that pops up or anything that's growing or changing, bleeding, those things are things that I can call about and get examined more quickly. I think it's also important that if you have a history of skin cancers, you see your dermatologist regularly. Now, some people are going to be wanting to do that every 6 months, every 3 months, or every year, depending on your baseline risk factors and how often you're getting skin cancers. But it's important to keep those appointments and get those cancers detected early. I just saw a patient today who, said, "Well, I wouldn't have known that this was a skin cancer if my dermatologist hadn't pointed it out." And so she was able to get something detected really early and probably saved her life. So I would encourage you to see a dermatologist and get that skin exam.
And if you can't see a dermatologist, because the
Mhm.
reality is sometimes it takes 6, 9, 12 months to get into a dermatologist, then what do you do? What do you
Yeah.
recommend?
Yeah. So, it's a common problem. We do have long wait lists, and people do wait a long time. So I think there are a couple options. One is if there's a particular spot of concern, primary care or urgent care can often do the biopsy. That can get sent to a dermatopathologist, and then you can get a diagnosis, and that'll take care of at least the immediate spot of concern. The second thing is to try to access some of these teledermatology platforms. I think those are often also useful for single lesions. And then, I think just sort of self-advocacy is really important too. If you have a spot that you're really worried about, you know your body, you know your skin, call and just let them know that it's something that's growing or changing or really concerning. And often we can get those people in for a spot check. I've done that where somebody's called in with a serious skin concern. Um, I think people are often willing to overbook and sort of squeeze people in.
Okay. And in our last couple of minutes here, can we talk a little bit about, so specific to basal cell and squamous cell carcinomas or skin cancers, talk a little bit about identifying them. So, for example, we know that squamous cells are more commonly found from the shoulders and up. So if somebody has something that they're worried about that's on their arm or their leg, are they less likely to have that diagnosis? Should they still advocate for themselves? So like we know kind of the the media descriptions of skin cancers, but the reality is skin cancer can happen anywhere. And also I'm going to throw in there if you could just also talk about people of darker color because we know that Caucasians are much more likely to have skin cancers, but any color skin can have a skin cancer. So just talk a little bit about those things. Maybe you could just throw them in together in the last
Yeah.
minute and a half that we have. Sorry to do that to you.
No, these are great questions. And I've had a lot of fun talking to you, Krista. So I think the first question is identify skin cancers. So if something is bleeding, changing, different colors, you need to have somebody take a look at that. Now, that's going to encompass some other things that are not skin cancers, and that's okay. I think the most important thing is that if you have a suspicion or a worry, that you get that checked. And it is never wrong to advocate for yourself. I actually appreciate it when patients do that. If they bring me a concern and they're vocal about it, I am happy to take care of it. And I would much rather, much rather have you come in and have me tell you it's no problem than have you wait and never, not see me and then have a bigger problem. So definitely speak up. Um, you asked about um, people with darker skin tones. So um, uh, if you have skin of color, that does not mean that you won't get a skin cancer. There are different kinds of skin cancers that you could get. And so I think it's still important to number one, see somebody if you're worried about something, and number two, keep an eye on your skin. And so, and also protect yourself from the sun. So we know that people with skin of color often have higher risk skin cancers. So they're less likely to develop one, but when they do, um, those skin cancers can be more serious. And that's because of a number of factors. One of those factors is that there are just different types of skin cancer. But the other part of it is just sort of awareness. And so, people with skin of color are less likely to necessarily realize that that's a skin cancer because it's just less common,
Yeah.
and are much less likely also to, or can be more likely to have a misdiagnosis because they have skin of color and it's just not at top of mind. And so I think, again, it's important to advocate for yourself. It's important to see a dermatologist and get a good diagnosis.
Yeah, that's a great way to end it. And so I encourage the audience to check out our website. There's lots of resources on aimAtSkinCancer.com, photos, different webinars. And if you feel a friend or family member could benefit from listening to this webinar, please, share it on our website. There is the link. So Dr. Yu, thank you so much. We might have to invite you back to continue this discussion. I really appreciate all your insights, analogies, and just practical advice. And thank you for joining us. Join us for our next webinar in March when we talk about clinical trials for skin cancer. And again, Dr. Yu, thank you very much for being here with me tonight.
Thanks, Krista. Really appreciate it.
Bye-bye.